Mental illness is not a normal part of aging, especially coming out of COVID and having many older adults and Canadians sitting at home a little bit locked in for the last little while, and anxiety building in some cases and new cases of anxiety happening for older adults. So our project has a few objectives and goals. I guess the main goal is to get the word out about mental health and mental illness among older adults. As well, we're looking to get the word out about some resources we've developed in the past to empower older adults to seek help if they're having problems with mental health and mental illness issues, and to educate healthcare practitioners in a broad area of mental health and mental illness issues around older adults.
So I want to tell you a little bit about the origins of the Canadian Coalition for Seniors Mental Health, which we founded in 2002. Initially, it was a project of the Canadian Academy of Geriatric Psychiatry, and we decided that it would be a good idea to bring stakeholders together from across Canada to focus on the challenging issue of seniors' mental health. The main outcome was to form a national coalition because nothing like this existed. Our main claim to fame, I would say, has been the development of national clinical guidelines. Our current project also focuses on guidelines. We're doing brand new guidelines. One is on anxiety and anxiety disorders among older adults. This has never been done before.
I'm very excited because that's a piece that we have been missing that is very, very important, especially coming out of COVID and having many older adults and Canadians sitting at home a little bit locked in for the last little while, and anxiety building in some cases and new cases of anxiety happening for older adults.
We're also going to produce a guideline that focuses on a critical issue of the behavioral issues associated with dementia.
We're excited to be able to address that because those are psychological issues that affect older adults when they're living with dementia, and those issues can sometimes be among the most difficult parts of living with dementia, especially for caregivers and loved ones that start to see that their loved ones are sometimes acting a little bit differently and have some personality shifts and can sometimes have a hard time managing with those things. So we're excited to develop some resources to help. This project's going to give us an opportunity to get the word out more about substance use disorders among older adults, including things like cannabis use, alcohol use, the use of benzodiazepines, which are sedatives that are prescribed often to older adults to help with sleep, and opioids, which are often prescribed to older adults to help with pain.
A core aspect of our work is connecting with clinicians across the country and providing them with tools so that they can take the guidelines and actually use them. But we also want to expand our reach to talk to the Canadian general public. We want to talk to older adults themselves, and we want to talk to caregivers so that they know the excellent knowledge that's contained in these guidelines and they can use it in their lives with their loved ones and to advocate for good care.